What works in the fight against Ebola and other dangerous diseases? In this brief talk, I will highlight 3 policies that proved to be key in the response to the Ebola crisis that hit West Africa in 2014 and 2015. The first policy that I would like to highlight is inclusivity. A common mistake is to believe that experts alone should design a response and implement it in a top-down way, for instance by using military forces. Actually, the Ebola crisis showed that policies designed and associating policies, patients, health workers and citizens were those that were the most efficient. Let me illustrate this with the example of the Ebola treatment centers. Ebola treatment centers are a kind of field hospital built for a temporary period to provide care for Ebola patients. At the beginning, these centers were built with fences around, armed guards at the entrance, and very few people who got in actually did come out alive. That is because of the extremely high mortality rate of Ebola. But as a result, people and community did not trust these centers and avoided them, which contributed to spread further the disease. What we learned from this experience is that involving communities is key to make these treatment centers efficient. And how can we involve these communities? Well, that could be by hiring trusted individuals to work for these treatment centers in order for them to report back to neighbors and friends of what is going on. Another way is to provide space for families to see what is going on in there and be more transparent. Finally, another option is to provide care for other medical conditions impacting communities to show that everyone matters, not only Ebola patients. The second policy that I would like to highlight is international cooperation and solidarity. Very few countries in the world are capable of handling a health crisis on their own, and having a global cooperation system based on solidarity is key to respond to epidemics. One of the success stories of international cooperation during the Ebola crisis is the development of an Ebola vaccine. The first Ebola vaccine proven to be efficient is the result of a fantastic cooperation to implement a vaccine trial in the middle of the Ebola crisis. This vaccine trial brought together the public health authorities of Guinea, the World Health Organization, and a wide range of public health institutes and research institutes who contribute to the scientific committee of the trial. But it also involved an NGO, Doctors Without Borders, who enabled the vaccine to be tested in their treatment centers on the ground. It involved the private company who owned the vaccine, and a wide range of donors, including rich countries and philanthropic organizations who sponsored the trial and made it possible. The success of this vaccine trial was also based on the premise of solidarity. It included that if the vaccine tested did work, the vaccine should be made available in priority to those needing it most, and not those willing to pay the higher price. Finally, the last policy that I would like to highlight is the need to have a strong public health system in place. Nigeria had a remarkable system in place to track epidemics and managed to limit the spread of Ebola to 20 individuals. This was a remarkable achievement given the risk of Ebola spreading to this densely populated country. Now, the reason for why Nigeria had this system in place is that the polio eradication program was very active in the country and had tremendous surveillance, detection and response capacities to deal with polio, and could thereby repurpose this system to track Ebola. Unfortunately, this system in Nigeria was temporary and is doomed to phase out after the full eradication of polio. But what this example shows is that having a solid public health system in place with surveillance, detection and response capacity is a precondition to respond to epidemic. It also shows that investing in basic health system does work. To conclude, now that we're in the middle of this new coronavirus pandemic, it is important to remember lessons learned from past experiences of fighting dangerous epidemics. We know what works, and I mentioned in this brief talk 3 of those policies that included inclusivity and community engagement, international cooperation and solidarity, and investing in health system. Thank you for your attention.